Hello, Department of Medicine. Welcome to our next segment of What's Up, Doc. I have with me Dr. Liz Brem, who joined the department on June 30th, 2016. Welcome, Dr. Brem.
Thank you.
Would you share with us about what attracted you to the specialty of hematology-oncology?
Yeah, I had some research experiences really early in my, what we'll call career, in college, where I spent a lot of time in a laboratory doing some research first involving leukemia and then sort of transitioning to some research involving lymphoma and trying to understand why some cells die and some don't, and why cells can become resistant to different therapies. So I kind of had that background as I sort of got to medical school and started thinking about clinical care. So it was in the back of, it was obviously something that was in the forefront when I was thinking about what specialty I wanted to pursue. But it wasn't until I got to the clinical rotations and spent a lot of time, particularly in outpatient oncology, that I realized it was a really unique field. There is a depth and an intensity of the doctor-patient relationship in oncology that I think is fairly unique. I have patients that I know what breed of dog they have, I know all of their grandkids' names, I know what various cities their kids live in, so there's something about the frequency with which you see the patients and just the intensity of what they're going through, that you get to know the patients and their families really well, and that's one of the things I love about it.
Thank you. Would you share with us what research area that you're most passionate about?
So my research, as I kind of mentioned, is in the lymphomas, which are a really diverse group of diseases even within the heading of lymphoma. But kind of within that, I'm interested in a family of proteins called the BCL2 family, and they regulate a specific type of cell death called apoptosis. And so I'm interested in kind of how that pathway gets dysregulated as cells become resistant to various therapies. But I am also interested in drugs that may target this pathway to kind of help push cells towards death, particularly the cancer cells towards death. How do we exploit some of the things that are different about this family in cancer cells?
Thank you. And what is one unique thing about UC Irvine that you appreciate?
Everyone is really, really nice here. The hardest thing about coming to a new place is sort of just figuring out how it works. Things as simple as where's the bathrooms, and things as complicated as how do I get insurance approval for this chemotherapy so I can admit the patient in a timely fashion. And everyone that I've asked for help with anything, whether it be the medical assistants, whether it be the pharmacy tech who I called 20 minutes ago, whether it be the gentlemen who were helping put together the furniture in my office, everyone is just so willing to help out, and it really makes it very inviting and easy to come into a new place, because coming into a new place can be very overwhelming.
Well, we're thrilled and excited to have you on board, Dr. Brem, and welcome to UC Irvine.
Thank you.
Thank you.